Everyone goes through knee replacement surgery expecting it to help them walk better, but some patients face complications that can lead to severe knee weakness, loss of ankle movement, and serious knee stiffness, all of which can devastate their mobility. The key is recognizing these warning signs early to reduce the risk of long-term or permanent complications. In this video, we'll go over the exact symptoms of 3 complications that can severely limit mobility after knee replacement, and what patients can do to improve their recovery. Hi, I'm Dr. George Bounajem, Dr. B for short, and I'm a Harvard-trained orthopedic surgeon who specializes in hip and knee replacements. No one wants to find themselves more limited than they were before surgery. The good news is that early recognition of these signs can help patients reverse course and get back on track with their recovery. Let's start with one of the most devastating complications that can happen after knee replacement: extensor mechanism disruption. This can cause such severe weakness that even just getting up and taking a few steps can feel impossible. The extensor mechanism is a mechanical chain that allows a person to straighten their knee with their thigh muscles, which is an action called knee extension. This mechanism includes the quadriceps tendon, the patella or kneecap, and the patellar tendon. You can think of this as a pulley system, where the contraction of the quadriceps muscle leads to straightening the knee. When this system fails, the ability to straighten the knee with the strength of the leg alone is lost. Since this system is also important in keeping the knee straight when weight is put on it, then an injury to this system causes the knee to bend under pressure and give out. Before we dive further, I need to be clear that this video is for education only, not diagnosis and treatment. If you have concerns, contact your surgeon immediately or go to the emergency room for evaluation. Back to the extensor mechanism. This chain can fail in several ways. The quadriceps tendon can tear where it attaches above the kneecap, the patellar tendon can tear below the kneecap, or the kneecap itself can break, also known as a fracture. The typical sign of this injury often catches patients off guard. They find that they suddenly can't extend their knee. This means that they can't lift their leg off the bed with the knee straight or extend the knee against gravity when the knee is bent. The knee usually also gives out when weight is put on it. There might be a pop in the knee during the tear or fracture, followed by immediate weakness. There's usually swelling around the knee, and patients may feel a gap or indentation either above or below the kneecap if a tendon tore. After surgery, it's normal for the quadriceps muscles to be weak, and it may be difficult to extend the knee against gravity. Some patients actually are able to extend the knee pretty easily right after surgery, but it's normal for other patients to have some difficulty within the first few days. The nerve block or spinal block given around surgery can also make it impossible to extend the knee with the strength of the leg alone, especially in the first few hours after surgery. But if a patient goes from being able to extend the knee after surgery to suddenly being unable to do it anymore, then that is a warning sign. If a patient suddenly loses the ability to extend the knee, especially if there's a pop and pain, then they should contact their surgeon right away. The extensor mechanism is critical in allowing the knee to support body weight, so without it functioning correctly, the knee will buckle and give out. A non-functioning extensor mechanism typically requires surgery, and delaying the repair makes the surgery more challenging and the recovery less predictable. The next complication surprises many people because it actually affects an area that wasn't even operated on: the foot. This complication is peroneal nerve palsy, more commonly referred to as foot drop. Foot drop is severe weakness of the ankle, which causes the foot to drag while walking. The peroneal nerve runs along the lateral side or outside of the knee and controls the ability to lift the foot up, an action known as ankle dorsiflexion. Like all nerves, the peroneal nerve functions like an electrical wire to send signals. In this case, the nerve sends signals to the muscles that lift the foot and the toes. The peroneal nerve has a small chance of getting injured during both the surgery and the recovery, usually either by being stretched or compressed. The most common sign is foot drop, which, like it sounds, means that the patient can't lift their foot up. It's also common for a patient to be unable to lift their toes. In fact, patients often trip on their toes when walking because the toes drag on the floor when taking a step. There can be numbness or tingling on the top of the foot and the outside of the lower leg. Some patients describe it as feeling like their foot is asleep, but it won't wake up. Symptoms of a foot drop can actually occur under normal circumstances because of nerve blocks given as part of anesthesia. The difference is that nerve blocks typically wear off within the first day or so, and control and sensation of the foot gradually return. With a true foot drop, weakness persists even after the nerve block should have worn off. The weakness with a true foot drop also tends to be specific, in the sense that patients can usually still push their foot down, but they can't pull their foot up. Weakness with nerve blocks tends to be more general, affecting both pushing down and pulling up. If a patient notices foot drop or persistent numbness beyond when the nerve block should have worn off, they should notify their surgeon the same day. Foot drop is often noticed while in the hospital after surgery, but it can happen at home too. The surgeon will likely want to examine the patient, and they may loosen tight bandages or dressings that could be compressing the nerve. In the meantime, continued use of the walker can help prevent trips and falls. Early diagnosis is important so that protective measures can be started, like an ankle brace that keeps the foot in a better position for walking. A brace also helps prevent the Achilles tendon at the back of the ankle from getting tight. Surgery to decompress or relieve stress from the nerve is sometimes performed, but other times the nerve is just monitored for improvement. Regardless of the treatment, the sooner that we make the diagnosis, the less likely there will be long-term problems. Our final complication is sneaky. It often develops slowly, but can permanently impact the function of the knee. That complication is arthrofibrosis, or excessive scar tissue formation. This can severely limit the motion of the knee, making it difficult to even just stand up from a chair or a toilet seat. Arthrofibrosis is the body's healing response going overboard. It's normal for scar tissue to form around the implant, but this excess scar tissue limits the motion of the knee and can prevent normal knee extension and knee flexion. Being consistent with physical therapy can limit excess scar tissue formation, but arthrofibrosis can sometimes occur even when doing everything as instructed. One reason for this is that a patient's genetics has a lot to do with how much scar tissue forms in the knee. Here's what to watch for. If the knee's range of motion isn't improving despite consistent physical therapy, that's the main warning sign. Recovery timelines differ between patients after surgery, but by 6 weeks, most patients should be able to bend the knee to 90 degrees or more. If the knee is stuck at less than 90 degrees, or if the knee is losing motion that it had gained earlier, then those are warning signs. Patients may feel like there's something physically blocking the movement of the knee. It may also feel like there's a tight rope or a band around their knee that just won't stretch no matter how hard they try. After knee replacement surgery, some degree of stiffness is completely normal. After all, the knee has been through surgical trauma, and it takes time for the inflammation to come down. It's also really important to remember that scar tissue after surgery is completely normal and even inevitable. Every patient who has had a knee replacement has at least some scar tissue. Normal stiffness after surgery is pretty consistent day to day and gradually improves week to week. But here's what's different with arthrofibrosis. The scar tissue forms too much. It feels like hitting a brick wall. No matter how much stretching or hard work goes into physical therapy, the knee simply won't move past a certain point. A plateau can occur for weeks, and one might even lose motion that they had previously gained. If motion has slowed, and especially if 90 degrees hasn't been reached by week 6, then the surgeon should be notified. Here's why timing is so critical with arthrofibrosis. There's a window of opportunity before 12 weeks after surgery where we sometimes perform a procedure called manipulation under anesthesia. During this procedure, the patient is put under anesthesia, and the surgeon gradually moves the knee through its full range of motion to break up the scar tissue. Most patients who have this procedure done within that 6 to 12 week window gain significant range of motion. But here's the catch. Wait until after 12 weeks and that scar tissue tends to get stronger and harder to break. Some patients who miss this window end up needing an actual surgery to cut out the scar tissue instead. The bottom line is this. Patients who aren't progressing with motion despite doing physical therapy can benefit from speaking up early. Early intervention can make a big difference in the knee's outcome. These 3 complications account for some of the most important mobility issues to be aware of after knee replacement. While they may not be immediately life-threatening like blood clots or serious infection, they can significantly impact mobility and function. Most patients fortunately recover after knee replacement without any of these issues. But if a complication does occur, then knowing these warning signs can help prevent long-term or even permanent problems. Remember, don't hesitate to contact your surgeon if something just doesn't feel right. Speaking of prevention, one of the best ways to prevent severe knee stiffness is to start with the right exercises from day 1. I'll link my video covering my top 5 exercises in the first 2 weeks after knee replacement right here. Click the like button if this video helped you, and leave a comment about what you'd like me to talk about in the future. Stay well, and I'll see you in the next video.